Flagstone Medical is bringing real hope to men who are suffering from erectile dysfunction with some cutting-edge technology called acoustic wave therapy. Welcome back to the show, Patient Care Advisor Bill Jeffries. Nice to have you back here.
Thanks, Alex. Good to be back.
Of course, always great to have this conversation because there's a lot of guys out there who are suffering in silence maybe, and it's good to get the talk started, right? So I mentioned acoustic wave therapy, and some people might be wondering, well, that sounds pretty advanced, pretty fancy, but what is it and how does it work?
Well, understanding that erectile dysfunction is really just, it's a plumbing issue. It's a blood flow issue, and it's caused by, as we age, there's a buildup of plaque and blockages in our arteries, and they just restrict blood flow. What the acoustic wave therapy does is it breaks up that plaque, it breaks up those blockages, and allows proper blood flow and also brings new blood flow to the area. If you think of it just in terms of dialing back the biological clock a decade or two.
And there's a very simple illustration to show what a normal way looks like and the narrowing of it, and it's amazing what this technology does. And it differs from the old standbys like ED pills and injections and so on and so forth. What are the essential differences?
Well, the way the standby ED medications and injections work is they attempt to dilate the blood vessel to allow more blood flow. The acoustic wave therapy takes a different approach and says, well, let's not dilate the blood vessel, let's get rid of the blockages.
Right, and some people might wonder, well, this is a medical procedure. Am I going to have to see my main doctor first, get a referral from them? I mean, obviously, it always helps to have a conversation with your doctor, but do they need a referral to come to you?
A referral's not needed. We always encourage patients to talk to their family doctor about anything that they're doing medically. We have a doctor on staff that sees every patient when they first come in. We do a thorough physical exam to make sure that the acoustic wave therapy is suitable. One of the things we find quite often is that a patient will be maybe taking a medication that is aggravating their ED issue. So our doctor might make a recommendation, hey, go back to your primary physician and maybe he can tweak this or substitute that and still get the same effect.
Well, it's a partnership, right? You have to have both ends of it, and you have to have everybody communicating, or you communicate with everybody. And it can be a difficult topic for guys to bring up and to discuss. So when they visit Flagstone, what can they expect as far as having that conversation?
We work pretty hard to make sure that patients are comfortable when they come to talk to us. Our staff is all male. There's a lot of information dispensed. We educate our patients on the causes and the various treatment alternatives of ED, and we just work hard. As I said, it's a medical condition that we treat all day, every day. So we're experts in the field and make our patients feel comfortable.
Yeah, and although it's a very personal issue, it's very individual to the person. It can also affect couples, right? So what advice do you have for someone out there saying, my man could use this, could use at least some guidance about this? What advice do you have for them to start that conversation?
It's funny, it's often the spouse that makes that first call, to get educated and just find out what it's all about and to determine, what it is and is it suitable for their partner. Erectile dysfunction really affects both partners in the relationship. So, from that standpoint, I would just advise that the significant other would, get educated, recognize that it's a medical condition, but the good news is we can fix it.
That is good news.
We can bring hope back.
That's right. And I mean, we saw that graphic at the elephant in the room, right? Who knows what type of toll it can be taking on you personally, subconsciously, but also on your relationship. I mean, if your love life just isn't what it used to be, this helps you bring back that hope, restore that feeling inside that we can all feel. And so when we're talking about men of different ages, is there a limit, upper or lower?
There's not. We've successfully treated men from their 20s to their 90s, so there is no age limit. Erectile dysfunction typically affects guys over 50, but there are exceptions to that, and the older guys get, the more likely it is that they've had some ED issues, and we can successfully treat those.
Right. It's a human thing. right? Let's talk about it. Let's get it resolved. Let's move on with our lives and feel that hope again and feel that spark again. So, Bill Jeffries, as always, nice to see you.
Thanks.
Thank you. And right now there's a special offer. You can get a free initial consultation if you mention the Morning Blend. That's a $199 value. If you want more information, visit flagstonemedical.com or call 520-600-4405.